For the record, could you please state today's date and your name?
Michael Welch. Today is the 13th, I believe, March 13th, 2010.
Can you state your date of birth?
13161.
What branch of service were you in?
U.S. Navy.
What rank were you in when you left the military?
E4.
Could you elaborate?
Petty Officer, 3rd class.
Okay. What was your job?
I was a dental tech.
A dental tech?
Yes.
Were you enlisted or were you drafted?
I was enlisted, volunteer.
What age did you enter the military?
17.
Did you travel?
Not really. I stayed in California the whole time. I was at a Marine Corps base at the Naval Regional Dental Center, Camp Pendleton. And then after that, I was on the USS Dubuque, which didn't go anywhere.
What did your job consist of?
Providing dental care for all the Navy personnel on the ship or the Marine Corps personnel on the base. So we did dentistry, basically.
Why did you get into that type of work?
I had 3 choices. I was going to be a UDT SEAL, which was pretty much undercover work, that type sort of thing, or a dental technician. And the dental technician school came open first, so that's why I chose that one.
Did you have to go through basic training like everybody else?
Went through boot camp in Orlando.
How was it?
It was pretty good. It was strange for the first 2 weeks, but then after that it was pretty easy.
Did you have any bad experiences in the Navy?
I experienced some racism at Camp Pendleton. They had Oceanside, California, and the surrounding area, Escondido, California, had that was one of the homes of, I think his name was Tom Metzger. He was like the head of the KKK in California. So we had little things that went on, but other than that, I had a great experience.
What did you guys do for entertainment?
Well, basically for me, the Navy was just like a job. I went to work from 7 to 4, and then I had my own apartment. So we'd go to Los Angeles, and just like everybody else does, hang out, go to clubs, that sort of thing.
How many times were you on the ship, if you were on the ship?
I was stationed on a ship for 2 years.
And it didn't go anywhere?
Didn't go anywhere. I've been out in the ocean maybe a week.
Did they ever let you guys jump off the ship?
No. No, it was in, actually our ship was in for repairs, so we just reported to work, and we had a dental office on the ship, and we would do dentistry there, and then go home at 4 o'clock.
Were you married when you entered the service?
No, I wasn't.
Did you have any kids?
Yes, I did. I got married after I was in the service. I had 2 boys, Michael and Gabriel.
How did you communicate back to your family during those days?
They lived, it was good. They lived with me. We had an apartment, so.
Really?
Yeah. So I think most people think, you know, the military is like you're way over here. It depends on what you do. And basically, for me, it was just like going to work from 7 to 4 in the afternoon, and then come home and be with your family.
Can you tell me a little bit more about basic training? Like how were you feeling when you first stepped off?
Oh, when I first got off the bus. Well, actually, when I went to register down in Miami, it was a little different, you know, because you always see the stereotypes, and, you know, you're kind of apprehensive. I was 17 years old, and then when I stepped off the bus at the Orlando Training Center about 3, 4 in the morning, and it was a shocker, you know, everybody with the shaved heads, but it was good after that.
Did you get along with your drill instructors?
Yeah, ours were called company commanders, so they had, I used to call him the Frito Bandito. He was a little Filipino guy, about 4 feet tall, but and they were pretty nice, you know. During the 2nd week in boot camp, they had what's called back staff day. That's when they initiate you into the Navy, and they had all these old salty sailors come in, and they call you everything, every name in the book. It took us like probably about an hour to do 15 push-ups. That was the worst part of boot camp, but after that it was smooth sailing.
Did you ever get in trouble in the military?
All the time.
Like in basic training?
No, never got in trouble. No.
did you go to college?
Yeah, I took healthcare administration through Southern Illinois University.
How was that?
It was good. The Navy paid for 75% of it, so it was pretty good.
Pause the camera.
Why did it take you guys an hour to do push-ups?
Well, they'll come in and they tear your bunks down, they get in your face, they put underwear on, they just intimidate you and you can't show any expression. And then when they tell you to get in the push-up position, they'll say down, and they might hold you there for 15 minutes while they talk about you, and then they up and down. It just took a long time, so they just, I guess, what's the word for it? They try to humiliate you while they're doing that, to break you. Mm-hmm.
How did you handle it? Were you cool and calm about it?
You had to do it, it's like fear, you're intimidated, but you have to do it, because if you mess up, then, there's repercussions for it, so.
Did you ever just want to say, I quit, I'm through, I'm done?
No, I'm not a quitter, so that wasn't for me. I had some friends that did quit and go home, though.
Did they segregate? Was there any segregation in the military?
There was segregation in boot camp. We trained with the girls, so we were segregated for 2 weeks, and then after that we mingled together.
How was that?
Oh, I loved it.
How was the food?
Navy had the best food. They had award-winning chefs. It's not like, you hear stories about the Army and the Marine Corps. We had good food. Very good food. They had award-winning chefs that cooked our food. So when you went to breakfast in the morning, they asked you how you want your eggs. They would scramble them, make omelets, whatever you wanted. You could eat as much as you wanted. Same thing for lunch and dinner.
If you could go back in the military and choose another profession, would you?
If I could, if I wanted to, yeah, I would choose another profession.
What would it be?
I would probably go into computers, because that's what I do now.
Really? What does the service make? Why does the service make you cut your hair?
I think it's for hygienic purposes, first of all, because people have head lice and stuff like that. And then it's also, too, it's one of those things, I think, to mentally get you to a point where you're subconsciously, psychologically stripped of everything. A lot of people, you had people, back in the day when I went through, people had big afros. And when you cut their hair, it's like, yeah, they were really shocked. So. But I think it was more for hygienic purposes. If you have 80-something people living in a barracks, you don't want head lice, and they're just coming in from off the street, too. But I think it was more hygienic.
What were the limitations that you had to follow?
What sort of limitations?
Did you guys have any restrictions or any rules that you had to follow?
In the Navy?
Mm-hmm.
Yeah, you had to be to work on time. You had to perform your job right, and that's about it. I mean, you couldn't go out and rob banks or anything like that,
Did you guys ever pull any pranks?
I used to do it all the time. I was the jokester. I used to put itching powder on the little people. We had a basketball court in the back of the clinic, and we would go play basketball at lunchtime. And then we had showers, so everybody would come in and shower, and I would always put itching powder on people. So I thought that was pretty funny.
Did you ever pull a prank on one of your drill instructors?
No, you didn't do that, no.
Were you scared?
I just never thought to do that to them. They were in a position of authority, and you're in boot camp, you don't know anything about the military, so, you just follow the rules.
What was the best prank you ever pulled in basic training?
I didn't pull any pranks in basic training. The itching powder incident occurred when I was, actually in the field working in the dental office.
Were any pranks pulled on you?
No. I led a boring life in the Navy.
you control any heavy machinery?
Yeah, drills, dental drills. It wasn't heavy, but you could mess some people up with it. So basically I did dentistry in the Navy. So if people had cavities, needed their teeth cleaned, needed root canals, bless you.
Thank you.
You can edit that out. Whatever, that's what I did. So you could call that heavy machinery because that drill is moving at 30,000 revolutions per minute with a sharp little drill on the end. So you could say that. And of course the needles and everything too that we handle. Yeah.
Can you explain to me in detail about the entry into basic training?
As much as I can. That was about 30 years ago. Let's see. Basically, you know, you get off the bus, depending on what time you get there. I got there about 4 o'clock in the morning. And I think they called it RIF. It was the Recruit Intake Facility. You go in and there's these hundreds of guys in the middle of the night, shaved heads. And we checked in. I don't think I got any sleep that night. The next day it was consisted of getting your hair cut first. That was the main thing. They shave off all your hair. I don't care. I had a short haircut at the time. They shaved it off anyway, what I had on. Then they issue your clothing. Basically you just get your boot camp clothing. You don't get your actual naval clothing, the suits. We had the double-breasted suits and all that stuff. We didn't get that until we got ready to graduate. So basically you got dungarees and, you know, Navy bell bottoms and the shirts. And then when you got ready to graduate, they give you what's called the Cracker Jack uniform. You ever seen the Cracker Jack man with the little flap? Mm-hmm. We had that one. We had a blue one, which was actually black, and then we had a white one for the summer. And then we had the whites, bell bottoms, and what else did we have? I think that was it. Yeah. Consists of like three different. They do it seasonal for you.
How was your dentistry career? Like, what was your worst case?
Oh, I had a lot of them. I think I remember this one young kid coming in. He was in the Marines and I actually had to hold his teeth in place while I cleaned them because he had so much tartar and stuff built up on his teeth that was the only thing holding his teeth in place. That was about it. That was about it. We did a lot of surgery and stuff, but I like, you know, doing surgery. Yeah.
Did you guys have military balls back then?
We had, I remember they had a Marine Corps ball at the time, and the Marines invited us, and we went to that. Boy, you're going way back. That's a long time ago. But they had the Marine Corps ball. The Marines were up under the Navy. You know, we'd pull up with the boat and we'd drop them off and then we go and let them do the fighting. So that's basically what the Navy does.
Did you train with the Marines at that point in time?
No, I never trained with the Marines. You did have a section of dental personnel that actually went out in the field with Marines, and they would set up tents and portable dental chairs, and they would do dentistry under wartime conditions. Like, you ever seen MASH? Mm-hmm. That's basically how they would set up a dental office. Mm-hmm.
If they gave you the option to go into war and do dentistry work, would you?
If I had to, I would go, but, you know, you're in the Navy. If they send you somewhere, you have to go. Mm-hmm. It's not like you have the option of saying, well, I don't feel like doing that.
Do you wish you traveled more?
Yeah, I do. Yeah, that was the only disappointment when we were graduating from our A school. My last name is Welch, so I was at the bottom of the list, and everybody was going to Hawaii, Puerto Rico, Guam, all Philippines, all these exotic places. And when they got down to me, they sent me to the Marine Corps base. And I hated it for about the first 2 or 3 months, but then I started to get out and see California, and I started to enjoy it.
If you had the choice of where you wanted to go, where would you go?
I think I would have went to the Philippines or Puerto Rico.
Why?
That's a guy thing. Keep it clean.
Do you have a dentist office? Like,
no, I retired. I got out of dentistry in 2003. I went into full-time ministry in Atlanta. I work with the homeless and addicted, men and women, providing transitional housing and counseling for them and help them get back into life. And I also run my own company. I do multimedia and web and graphic design.
How many years did you stay in the Navy?
5 years.
Oh, so you did a year over your contract?
Yeah, to get the dental field, you had to do 5 years active duty, so I didn't have to do any reserve time.
Is it true that for the first 73 or 75 hours you don't get any sleep? And basically
That's probably because you're doing so much so fast, you get very little sleep, and basically it was lights out. Let me try to remember, it was a long time ago. I think they turned off the lights at 8:30, 9 o'clock, and you were up 3 o'clock in the morning. Your day started at 3 o'clock in the morning.
Even as a dentist, you still had to do PT?
No. We did it on our own. We didn't even have formal. We were so informal. We had maybe, you know, the company inspections probably about once every 6 months, when most people did it every week or once a month. We were very informal.
So, do you like the fact that you were in the dentist aspect of the Navy, so you wouldn't have to do so much PT?
No, actually, I was very physical. I played basketball probably 2-3 times a day. I played on the dental office. We had a basketball team. I was very athletic back then.
If you had a choice to go back into a different branch, into the military, would you?
No, I'd probably go back to the Navy, because I like the Navy.
Do you think the military has changed since you were in it?
Well, I'm sure with the technology and everything, they've grown a lot in technology. That was 30 years ago. I mean, we had aircraft carriers and destroyers and all the weaponry and everything, but I'm sure it's a lot more technologically advanced right now. Yeah.
Okay, have you experienced any emergencies while in your line of work, your dentistry?
Yes, I have. First one, we used to work on a section of Camp Pendleton where the Marines would come and do rifle training, and we had a lot of attempted suicides with the young guys, the recruits in the military, well, in the Marine Corps, for instance. But one guy took an M16 and blew his brains out. And the medical side was here, and then you had the dental office here, and then we had our ping pong table where we played, got real good at that. But so we saw a lot of stuff go on. We did have, when I was stationed in San Diego, we used to treat retirees, and one guy had a heart attack in the chair. But you saw a lot of people trying to kill themselves in the Marine Corps.
Why do you think that?
Because of the stress. The Marine Corps, the Marines, I'm glad they're on our side, because a lot of them were really crazy. And, you know, the stress of being away, just being in the military, a lot of people couldn't handle it. So I guess that's what it, and, you know, being on drugs or whatever. But I saw people cut their wrist and do all kinds of stupid stuff. Yeah.
Now, based on TV shows and commercials and a little bit of infomercials and information that we get from schools, supposedly the Marines, correct me if I'm wrong, is the hardest branch of the military, or the most rough or rowdiest?
Not really.
Not really?
Not really. I mean, every branch has its certain little segment. Like the Navy had the UDT SEALs, the Underwater Demolitions Team. You know, those are the guys you see in the middle of the night in the scuba gear coming up into the war zone. They're there before the United States even lands on the beach. The SEALs have gone in and done what they're supposed to do. The Marine Corps, you have, you know, you got people that fly airplanes, and you have what they call grunts, that they're just out there shooting guns, you know. The Army has the same thing. I think the Air Force is pretty much, they just, you know, they might get a hangnail or something, but that's about it.
Right.
Yeah, yeah.
Okay. Oh, do you have your own dentistry?
No, no. I was what you call a dental tech. Basically, we were trained to do any dental procedure under the supervision of a dentist. Now, of course, in the military, that's really good, but when you get out, I've worked for some dentists that let me just, you know, because I made them a lot of money. But I got out of it in 2003. Last practice I worked in was in Greenbrier Mall in Atlanta, Georgia. Yeah, so I worked all over Atlanta. When I first got out, I worked at a practice here in West Palm Beach.
Okay.
But that was only for a year, and I got up out of here.
What ranks did you get? Did you get any ranks?
I was E4,
E4,
E4, petty officer. Actually E5, I was paid, but I never got paid for it. President Reagan was cutting back on everything, so we got the title, but we didn't get the pay. That was back then, so yeah.
Well, how many locations have you been through? Like, could you chart it out from basic training and going into your actual field of your NOP?
Let's see, I went to boot camp in Orlando, which is now closed. That's no longer there. Then I went to San Diego, 32nd Street Naval Station for my A school training. And then once I graduated dental technician school, I went to Camp Pendleton, where I stayed for 3 years shore duty, and then I transferred to the USS Dubuque for my sea duty, which I didn't see any sea. I've been out in the ocean more times on a cruise ship than I have on a Navy boat. Mm-hmm.
Okay. You never got a chance to go overseas then?
Nope.
Never got a chance to go overseas. Okay.
Been as far south as Mexico, that's it.
Okay, and you haven't had a chance to serve in any wars, did you?
We had the Iranian hostage crisis. Back then it was when Jimmy Carter was president. It was back before y'all's time. Jimmy Carter out of Georgia, he was president, and the Iranians were taking people hostage. They would hijack planes and stuff like that. And we had that little incident. And then we had Beirut. I got out just as we were moving into Beirut. Matter of fact, my ship ended up over there. I had a few friends that got killed in the bombing when they bombed the Marine Corps barracks over there.
Now, could you explain your A school training? Is it all just the field that you picked? So it's all
dentistry. All dentistry. Basically, it's pass or fail. Either you get everything right or you fail. And you have 3 chances. Once you flunk 3 times, they kick you out of school. So there was a lot of stress. I did very well, except on, I think it was the instrument identification. They throw all these dental instruments in a tub and you have to pick them out. And of course they give you carbon copies, so you can't really see what the instrument is. And I made it to my third and last try, and I passed, because otherwise they send you out to the fleet. You end up chipping paint on the side of the ship and hanging over the side, and I didn't want to do that.
So that was the discipline.
Yeah, you had to really study. Yeah, you had to really study, because it's a field where there's no room for mistakes, and that's what that's basically what dentistry and medicine too. You know, you don't have room for mistakes. So either you get it all right, or you start over again.
Correct.
Mm-hmm.
Now, with your field of dentistry, when you're working on a patient, have you ever had them go haywire and flip out trying to get out?
Yeah, not necessarily in the Navy, because they had to be there. It was mandatory. They were ordered every 6 months to do their cleanings and stuff like that and get their checkups. But when I was in civilian life, you know, you have people under the laughing gas, as you guys call it. They start hallucinating and doing crazy stuff. But that's about it.
Okay. Mm-hmm. So there is such thing.
I've been bit. I had one lady, she just freaked out. She bit me so hard that her jaw locked. So I couldn't get my finger out. But other than that, people throwing up, that's the worst thing.
Oh, really?
Yeah, and it got to the point I would make them clean it up, because I wasn't, you know, you get tired of cleaning up vomit.
Right.
Yeah.
Sure. So you were an M5.
No, E5.
E5, excuse me. E5 petty officer. Now, could you explain the ranks from the bottom up, and where do you stand?
You have E1 is your recruit. So in the Navy, it's called seaman recruit, or either dental recruit.
Okay.
So when I was in boot camp, I was a dental recruit, but so when I wrote my letters, it had DR, so everybody thought I was a doctor, but they didn't know. And then you have dental apprentice, that's E2. Then you have dentalman, which is like seaman, but your dentalman, that's E3. And then you have petty officer, 3rd class dental technician, and then petty officer 2nd class dental technician. Then you have 1st class petty officer dental technician, which is E6. And then it goes up senior chief and master chief. Master chief is the highest you can attain in the Navy.
Okay. Now,
Enlisted.
Unlisted. Now, in unlisted.
Enlisted.
Enlisted.
Mhm.
Okay. Now, in the reserves, is there still the same thing?
Yes, it's all the same rank. Yeah.
Same ranking. Okay.
Mhm.
Now, what does petty officer mean? Does that mean like low?
No, it's just, that's the term that's been, I never, maybe I need to research that, Google it. I don't know what it means, it's just a ranking, you know, like admiral or, you
Or
know.
private?
Right,
Or-
exactly.
Okay, I understand that.
Mhm.
So there is no colonel in the
Not in the Navy,
Not in
you
the
have
Navy.
captains.
captains.
You have, and then in you're talking about officers now, so you have lieutenant commander, commander, captain, admiral, junior grade, I think it is, and then admiral, then you have vice admiral. Vice admirals are the ones you see sitting at the Pentagon around the big tables. They're the big guys.
The big guys.
They're all the way at the top. They make the decisions. They're, you know, yeah, it's really big.
Did you get any awards or any achievements that you have?
I was Sailor of the Quarter. That was about it. I got a Battle E on the ship, but everybody on the ship got that. You know, when you earn a Battle E, that means your ship is ready. It's been inspected by the fleet. Everybody gets a little ribbon that goes on.
On the ribbon bar.
Yeah.
Okay.
Mhm.
Explain some time or describe your time on the ship. How is it? Is it very cluttered?
No, not at all. The
Safe.
ship that I was on, it was 957 people aboard that ship. We had a 3-man dental office. It was one dentist and 2 technicians. We had 2 dental chairs, and we used to actually have seat belts coming up from the wall, so when you're out at sea and you're doing dentistry, you know, the dental chairs roll, so we had to strap ourselves in. But there was a lot of room on the ship, and on the aircraft carriers, you might have 5,000 people on there. So there's plenty of room.
That's what I was
for
going to
everyone.
ask you about aircraft carriers. Now,
Mhm.
those are just ships. They're not.
Yeah, they're
they're not
ships.
stationed.
No, they float.
They float.
Yeah, but they go into port. You have to pull into port, get overhauled, get supplies, that sort of thing. I've been on the Constellation. I had a friend from here that was on the Constellation. I went over and saw him. It was huge. Huge.
Sounds very huge. It has planes on it, so it has to be-
Exactly, and the planes come up from in a little containing area, and they come up by elevator.
Oh, really?
And then the actual slingshot
Yeah, the
shoots them
slingshot
off.
shoots it off. I've seen that on a video.
Yeah, it's very interesting.
That looks very interesting.
Yeah.
And it's how it works. I think it uses steam or something. I was wondering.
Yeah,
Right.
between the jet engines and that big thick cable, that's
That
how
pulls
they
it.
Yeah, pulls it right off the ship, and it catches them when they come in too.
Oh, really?
Yeah.
So they can't just lift off on their own then? They can't
Yeah,
just
they can, but
It's probably more of a risk.
with the boat going like this and like that,
Yeah.
it's, you know, they've done the engineering
Right.
of it, and they figured that this is how they do it. So.
It's the best way.
But they have planes that they go straight up. You know?
Yeah, like helicopters and
Mhm.
such, right?
Mhm.
Okay.
Yeah.
So being in a barrack, how is that like? Is that like the whole? I'm just gonna give you an example. The whole Anne Frank thing, being in a barrack, kind of.
No.
So it's very clean. Is it?
That was
clean?
in boot camp. Yeah, that was the only time I lived in a barracks in boot camp. It was 87 people, but you had to keep it extremely clean. You know, so we actually used neutral shoe polish to polish the floors. You know, you had a crew of like 6 people that would actually, or you could walk in our floors and it was so shiny, and the bathrooms were immaculate. But you have to, you know, you got 87 people in one place, you know. So for hygienic purposes and, you know, all kind of diseases and stuff like that, you have to be careful.
Now, with the people that are enlisted that you can encounter while you're there, are there just anybody? What are the requirements to go into the military? Like, if you couldn't just be a guy off the street, wouldn't you have to have some type of credentials?
No, I was a guy off the street. I was just out of school. I went in, took what's called an ASVAB test. They test you to see where you would place in the military. You know, some people don't score high well intellectually, so they might end up just running around with an M16. And then, so basically when you go into the recruiting office, they do what's called the ASVAB test and see how you score, and then that qualifies you for different positions in the military.
Correct.
In the Navy.
Right.
Or
in the Navy or any branch.
Mm-hmm.
Or so. Now, there really isn't any type of put out. Then there's nothing that you cannot. There's not.
Well,
really
if you're
a
and if you're, they're going to do a background check on
right.
you, make sure you haven't killed 8
right.
people and are hiding out,
right.
So but that's it.
That's pretty much it.
Mm-hmm.
Gotcha. Okay. When you said that you had your own apartment and you were on, you could basically, you don't live on base.
Mm-hmm.
You don't have to live on base.
Mm-hmm. I lived on the ocean, actually. I had an apartment on the ocean. My first apartment
So
was on the ocean.
But in basic training, you had to
boot camp, yeah. You were in the barracks. You were in boot camp. But once you get out, actually, I think some people had their own apartment in A school. But when I got out, they pay half of your rent. And yeah, so I had a little 1-bedroom apartment. It's nice.
And this was all in California?
Mm-hmm.
Okay. So, and that's like a nice sunny place. It doesn't really rain there.
Oh, it rains a lot.
Oh, really?
Around January, late December, January, February, you got mudslides. All the houses slide down the hill.
Hills.
And then they build it right back up. And then during the summer, you have your fires and everything burns down. But it's just a natural occurrence. It keeps balance, Every year, if you watch the news, you'll see when it's raining, California's flooding.
Yeah.
During the summertime, they got brush fires going on that's
right.
burning hundreds of acres. Yeah.
And that's not
But
too
the
good.
weather there is, it gets sunny. It doesn't get hot like it gets here. And then around 3 o'clock, it starts to cool off.
Really?
It's a pretty place.
I heard it's very pretty. Now, back on the, what else? I was going to say. With the basic training, once you're in your basic training, that is the boot camp. So it is the whole PT, but it's probably not in your field. Maybe.
Oh yeah, in boot camp you run, you do push-ups every day. You swim. We had swimming tests. Of course they got to teach you how to swim in the Navy.
Right.
But boot camp, that's what it's about. And then we had a lot of classroom stuff too. So yeah.
That's true. Now in the Navy, do you also have the camouflage uniform also? The like Army? No. I mean, I imagine the SEALs might wear camouflage if they're out in a wartime where you need to be camouflaged. Right.
I was in the dental office.
So yeah, you were like, I forget that. So you didn't have to do any type of action then.
No warfare. Now I knew how to shoot an M16 and 45. If I was in a wartime. Say this was a dental office and we were in Iraq right now. I have to know how to shoot a gun because you're in a place where people are going to shoot at you.
Right.
So
correct.
Yeah.
And when you're in training with the guns, how does that work? Is that like in your stages? Say there's 4 stages of basic training. How would that be?
Now I don't even remember where that came. Boot camp was 10 weeks. And somewhere in those 10 weeks, we shot an M16 and a 45, but I don't remember.
And you didn't have to carry it on your person, did you?
No.
You probably weren't allowed to carry it on.
No, it's too many crazy people.
Right?
Yeah.
Yeah, you had a lot of that.
Yeah.
And with your tools, with your dentistry tools, when that wasn't in basic training. That was when you went to your A school.
Right.
And then did you have to purchase? Well, I'm guessing you didn't have to purchase.
No, you go in the dental office. It's like going to work. They have all the tools and everything there. Dental chairs, X-rays, just like a dental office.
Okay, so there was no. It wasn't like a school setting then.
What do you mean?
Like
A school?
Yeah, was it like a college room setting?
Yeah. I think my class we have different facilitators. You come in and you do book work, and then you go get tested in a clinical setting. And we worked on dummies. They're called Dexters, and just the head. And they'd have teeth and everything. And you would take X-rays. You would do whatever, and the facilitators would watch you and make sure you were doing the procedures properly.
And you didn't talk to the Dexters, did you?
If they made you do it, to make that was part of making your patients feel comfortable. You know, so you had to greet your patients, and they would sit there and they would check everything off and look at your technique and everything. So,
right.
pretty
So
nice.
I was just imagining, how are you today? You've been
Right.
brushing and been flossing?
Yeah, we didn't go that far, but it was
but
you know, good morning. But they were dummies, and they just sat there with their mouth open. And depending what you were doing, if you were taking X-rays, they'd sit straight up, or if you were doing some work in the mouth, you would lay them back.
Really? And what were their teeth made of? They weren't real.
They were made out of an acrylic, a hard acrylic.
Really?
Yeah.
So you had to have something close to real to actually work with it.
Right. I mean, yeah. You'll never. A dummy can never recreate working in somebody's mouth. Saliva, breath,
right.
all kinds of. It can get to be pretty bad.
Yeah, pretty bad. Yeah, and I would guess because you're in somebody's mouth the whole time. And I noticed that with a lot of dentistries now, they make you mouthwash before they start.
Yeah, I guess that helps.
Yeah, but I guess sometimes
A lot of times it doesn't.
Really?
Sometimes you'd have to put stuff inside your mask. We had like an orange solvent or something, and we'd put a drop in our mask, and people's breath was really bad. But most of the time, we're just trying to help people out.
Right.
Yeah.
That much is very true. So, I'm going to ask you some questions about like being dentistry now. With root canals, how does that really work? What is it taking out the teeth?
No, you don't take out teeth, you take out the nerve inside of the tooth. So you get a cavity and it starts off very small. Teeth are organic material, meaning it's living. When you have bacteria that eats away at living material, that's what causes a cavity. Okay. Now, you guys know biology. When living things eat, they have excrement. And that's what the bacteria, those hundreds of thousands of microscopic organisms in your mouth, they're pooping in your mouth. So that's why you get the stench, and it starts to develop decay, and it eats away until it gets into the nerve. That's when you start to experience pain and sensitivity. When it gets to that point, then you have to have a root canal done. So at that point, most people either have a choice of getting a tooth pulled or having a root canal. Basically, with a root canal, you have to go in. I'm giving you a dental lesson here. You have what's called endodontic files, root canals. The dental terminology is endodontics, and they use little files that increase by millimeters, and you go in and you take the nerve out, and then you fill it up with a rubber material, and it's done. And actually, that was started by the Egyptians. Thousands of years ago, the Egyptians were way ahead of everybody. They did orthodontics, and they were doing root canals and brain surgery. Mm-hmm.
That's really deep. One more question.
And you talk about thumb sucking.
Oh, that's what I was going to ask you about. How does that?
What happens is sucking your thumb also works as a type of orthodontia, meaning it will move your teeth. So what we do when people are young, we put thumb sucking appliances that have little pricks that prick your thumb.
Oh, really?
Yeah, yeah. But what happens is you end up spending thousands of dollars when you get older.
So what do you mean when you say prick your thumb? It's in your mouth?
It's a little appliance that fits in the roof of your mouth. So when you stick your thumb in here, it pokes it. So psychologically, it's supposed to make you stop.
Oh, but you can't. But what if your tongue pokes it? Would it poke your tongue?
No, it's not positioned in a way where your tongue will prick your tongue.
Okay.
Yeah.
Okay. Yeah, because I was going to ask you about that. How does that work? Okay. Well, thank you for your time, sir.
No problem. I appreciate it.
We enjoyed it.
All right. Thanks a lot.
Please state your name for the record.
Michael Welch.
And today's date?
March 13th, 2010.
And the branch of service that you were in?
U.S. Navy.
And the years you were in there?
1978 to 83.
Thank you.